We will discuss today factors that are responsible for the endodontic treatment failure in permanent dentition. So the success in root canal treatment depends on the debridement of the root canal, which means the removal of the necrotic tissue, any infected pulp, microorganisms. That is first. And at last, it's a complete sealing of the root canal space. Why do we need such a complete sealing of root canal space? Because we have to prevent the persistence of infection or reinfection of the canal. Such a failure in the debridement, how can I know that this root canal have failed? Two ways. Either the patient will come back with pain or swelling, or a radiograph through which I can see if there is any periapical problem. We need some definitions to be clear for us here, like a healed tissue or healed root canal means that clinically and radiographically everything represented to be normal. Healing is a dynamic process. Okay, so you can see through the x-ray that there is a reduction in a certain radiolucency, which means that reduction in the size of the lesion. Okay, and definitely this should be accompanied by normal clinical presentation by the patient. A disease means that no change or increase in the radiolucency. Clinical sign may or may not be present, okay, or vice versa. There are many factors can affect the success or the failure in endodontic. So in every case, diagnosis has a priority and it's important. In every case, you have to put a treatment plan. And you need to do a radiographic interpretation because it's your bench point. From this, you can compare with it to decide, did you succeed in root canal treatment or that treatment was failed? Anatomy of the tooth, the canals, the inclination, numbers of canals in each root. You have to determine these before starting. Debridement of the root canal space is a must and should be done completely. Asepsis of treatment regime, it should be. Otherwise, a reinfection is expected. A quality and extent of the apical seal. Quality of post-endodontic restoration. How I will restore that tooth. Okay, this is important because any coronal leakage, and we will explain that, can cause a problem too. Systemic health of the patient depends on the healing response. Skill of the operator. You need training, you need skill to start such a procedure. So in failure, we will discuss local factor first, and then we will talk about the systemic factor that will affect the prognosis of endodontically treated tooth. Starting with the local factor, first thing is the infection. So from where such an infection comes, it comes when there is some infected tissue are left in the root canal, necrotic pulp in the root canal. Okay, if they are left there accidentally, so these will cause the irritation, and that irritation may extend to the periapical tissue. So what are the factors that influence the repair of the periapical tissue following endodontic treatment? If infected tissue is present, that's the host parasite relationship. Host is a human, parasite is the infection. Virulence of microorganism, their number. is one of the factors that affect the virulence of microorganisms. Ability of infected tissue to heal if the presence of microorganism. So here immunity can play a role as well as the virulence of the microorganism. We have lastly the apical seal or the coronal restoration. Are they optimal or not? Both of them are important. All of these factors, any defect in these factors will cause reinfection, which means failure. You see here that look, in the X-ray it's very clear that there is a deficient, no apical seal at all. That's important. Again, no coronal seal. In the picture, in the scheme here, you can see that this is a crown, or even if it was a filling, such a seepage, okay, of microorganisms, saliva, oral fluid will also cause failure. Second factor is the incomplete debridement of the root canal system. First, it was the infection. Second, the incomplete debridement. Complete debridement is one of the main principles in the success. If I have an incomplete debridement, which means that there will be some microorganisms left. That when I say a microorganism, which means they're toxins, and they may recolonize again, and they will cause an endodontic failure, because this means excessive hemorrhage, and that can happen during instrumentation. Sometime when you do instrumentation, you will extend beyond the apical tissue. You will have excessive hemorrhage, and that hemorrhage can cause mild inflammation. Such a accumulation of the blood with the presence, if they are not resolved normally, if they are present, okay, they will form a nodes for the bacterial growth. With the presence of infection, they will cause a failure. As I said, an over instrumentation, it will decrease the prognosis of the endodontic, because we are creating a trauma to the periapical ligament and the alveolar bone. Okay, so chemical irritants that can happen through the intracanal medicament irrigation, they will also decrease the prognosis of endodontic therapy, especially when we push the needle too much inside the canal. So the fluid may be extruded. It will be extruded into the periapical irritant, and they will cause inflammation in the region. If there is a bacteria, that can make it worse. If there is a remnant of necrotic pulp in the area, that will make it worse. And even though patient health, his general health, his immunity, because this might disturb the host balance, host microorganism balance, which means that the toxins, they will proceed causing infection. Some iatrogenic failures are there. They can happen during instrumentation. For example, instrument separation. Maybe it's improper selection of the instrument, or overuse of the instrument, or some forcing technique which are used with reaming and filing the instrument borders. They may stuck to the wall of the canal, and they will break sometime, mostly in narrow curved canal. So if the tooth was non-vital, the prognosis is bad, while if the tooth was vital, prognosis is better. Sometime during instrumentation, I might have some canal blockage, ledge formation. So in this way, if I have a ledge formation, okay, this will not allow a complete cleaning and debridement of the canal, because some of the necrotic tissue and debris will stay there. Some chips will be there. So I cannot reach the fucking length, what I should do. Perforations, they are very much expected because you are working inside a canal blindly. You depend only on your tactile sensation, on your feeling, on your knowledge of the anatomy of the tooth, on the x-ray, the curvature, the alignment of the tooth. All of these are important. Such a perforation is a bad failure, but we have to know what to select, how to select, when to select. These are important. Definitely the prognosis, if I had a perforation, is bad, but depend on factors, like for example the location. Is it close to the gingival sulcus, somewhere that I can manage and close the perforation and start my root canal again? And the time, was that perforation left for a long time without repairing? Then adequacy of perforation seal, size of my perforation. Okay, because if you seal it, you have to seal it in a proper way. Here in x-ray you can see such a perforation in the apical region, and the prognosis is bad at looks, because first is perforation, I am irritating the periapical canal, then there are a remnant of the pulp tissue inside the canal, and that can cause a big failure. Incomplete full tooth, which means that there is a lack of the apical seal. So sometime an under full tooth we should expect somewhere, somehow, especially if the canal was not cleaned enough or were not debrided efficiently. A failure is there always for you. How can I get this when I don't have the instrumentation was not complete, when there is a ledge formation, a blockage in the canal, improper measurement of the working length? Definitely, if I have a blockage, if I have some ledge formation, so the end up is improper measuring of the working length. So it's bad for such cases. Overfilling can happen when a filling material extruded 2 millimeter beyond the radiographic apex. So that material, whatever it is, it will be an irritant. So depend on the immune response of the person, it might act as a foreign body. Okay, and a biofilm, which is microorganism with their extracellular polysaccharide matrix, they will adhere to such a material, and will cause reinfection again. Corrosion of the root canal filling. Somewhere in the past we were using something called a silver cone, and I really like it when I have a neural canal. Whenever I have a neural canal, especially in the lower molar mesial side, I am doing the filling with gutta-percha, that is right, but somehow I feel that, wow, what an easy silver cone we were having before. They are sticks of silver, and they are very narrow, hard, harder than the gutta-percha. So we were filling the narrow canals with them. So such a material, they are prone to oxidation, and this corrosion mostly affecting coronal side or the apical portion. Definitely a fluid from the oral cavity and the apical portion with the presence of this silver can cause some periapical problem. So corrosion products are the cytotoxic and they are irritant, cause persistence, periapical change. Many anatomical factors are affecting our work, like overlay curved canal, calcified canal, numerous lateral canal, accessory canal, bifurcation, apparent canal anatomy, like for example C shape, S shape. All these problems are always there. That's why we need the x-ray. We need to understand the anatomy of the tooth that we are going to deal with. And when you look for the x-ray, look for details before starting. That's very important. Root canal fracture. Always remember that the horizontal fracture have a better prognosis than the vertical fracture. Even though both cases they have poor prognosis, but the vertical fracture is poorer than the horizontal fracture. And if I want to talk about fracture, I think I need a full lecture because it depends, especially with the horizontal fracture, it depends on the level of that fracture. Okay. Traumatic occlusion, definitely it will affect, okay, on the periodontium. Periodontal consideration, we have to think about endodontic failure if we have a communication between the periodontal ligament and the root canal system. We have to wait for such a cases. We have to treat the case, irrigate the tooth, and wait. Okay, we have to check the healing and then wait for the healing. At least you should be on safe sides. So, as we mentioned, there are local factor and there are systemic factor. Systemic factor are many, and most of them they affect the immunity of the person and affect the healing process. Patient with nutritional deficiency, diabetic mellitus, renal failure, blood dyscrasia, hormonal imbalance, autoimmune diseases, any opportunistic infection, aging, patient on long-term steroid. All of them they affect the immunity. A low immunity, you should expect delay healing. Delay healing, which means that unexpected infection. So this is the last slide in this course, and I wish you all good luck. Wish you the best, and thank you.